Good. Assalamu alaikum wa rahmatullahi wa barakatuh. Set. Half an hour, right? Half an hour.
The second speaker is in the meeting.
Okay, he'll be back what time?
He's in the meeting.
Okay.
In our meeting.
Okay, sure.
So the moment you finish,
Sure. Brothers are requested to please come forward, keeping in mind some of the brothers still offering their sunnah, inshallah. Alhamdulillah, alhamdulillah, rabbil alameen, wa salatu wa salamu ala rasulihil kareem. My dear respected elder brothers and sisters downstairs, before starting, I would like to make a request to all of you that today what we are going to spend time in, we should be making this time useful, spending here with the niyyah, with the intention that what we are going to hear, it is the best knowledge of ours, best scientific knowledge available so far. And scientific knowledge, when we talk about it, it's not that, I don't agree with science. Science is what we have evolved so far ourselves. How much do we know? And what kind of effort we have made to understand about different stuff. So with the beginning, I would mention that we already know a lot about coronavirus, but we have to question ourselves that how much I brought that information into my knowledge and that knowledge implemented in myself. Is it different than this whole thing started? Since then up till now, how many characteristics and how many changes I brought in ourselves? That previously I don't used to wash my hands. Now I know everything, how even to wash and for how many seconds. And like brothers, that how much we are ready to make changes. So inshallah then it will become very informative. It will be making a difference in our lives and in our family's life and in the community life. So inshallah from here we are going to start. First we have to, when we talk about pandemic, so we have to understand epidemic. Any time when we have any outbreak of any diseases, more than usual in our communities, it is called epidemic. We get sick, somebody have high blood pressure, but it's not that half of the community have high blood pressure within a small period of time. So this is called epidemic. And then it comes to pandemic. There's another term, endemic, but we are going to jump into pandemic. When this epidemic becomes common throughout the world, we are seeing the same thing. It's called pandemic, and this is what we are seeing, that this infection has become kind of universal throughout the world. Every country is experiencing it. Now the next thing is, what is virus and what is bacteria? We all, have this understanding. Even we have cold, which is normally caused by viruses, but when we go to a doctor with the expectations that I will get antibiotics so I will get better. So no, antibiotics are for bacteria, not for viruses. So viruses, these are the microorganisms which may enter into your body, but it needed your cell's nucleus to replicate themselves into millions and millions, and then it causes its effect and it makes you sick. Likewise, there is a bacteria. Bacteria are more independent microorganisms which are bigger than viruses, and they can go and multiply themselves and can make you sick. Some of the bacteria are good, which are all sitting in our different part internally, and this saves you from getting sick from the bad bacteria. Only the bad bacteria which are also sitting in your body, and when they get a chance, they make you sick. And surely at that time, doctor decides that if you need antibacterial or antibiotics or not. Just to give you some idea that how much anything can get serious. I think, including myself, we are not still taking it seriously. Yeah, it's going on. Yes, people died in China, but we don't like China. Now it's here. Maybe somebody else will get sick, not me. So, just to give you an idea, in 2018, what happens? It was a flu. It's called Spanish flu. 500 million people died. 1918. Oh, sorry, we are in bad. Who knows? 1918, this is what happens, that 500 billion, it mentions that at that time almost 1/3 of whole population of the world get killed because of this thing. So why it cannot happen this time? God save all of us, right? But keep in mind that things may get wrong. We all heard tsunami, right? No, I'm not much concerned because it didn't come over here. No, who knows? How Allah Ta'ala makes us aware or be aware of these things, that these things happens. And in that Spanish flu, 675,000 people died in America. So it's not that we are living in America and whatever we think of America, technology, ourselves. So we all are humans, part of human race, and we can also get affected of these kind of things. If we talk about coronavirus is not new. Coronavirus is there like a lot of other viruses, right? We hear of flu virus, influenza virus, parainfluenza virus, RSV virus, adenovirus, rhinovirus, and coronavirus. These are the common viruses which causes normal cold, and likewise other conditions. So, and the epidemics through coronavirus happened before too. And one was the time, it was 203 and 204. It happens that was, we all remember SARS. This is also a type of coronavirus. It is spread through a cat, it's called civet cat. That was the means of transferring it to bring it to the human beings. So what happens when you have a regular virus, but virus can make changes. That's why you hear when every year flu vaccine is different. Why? Because they evaluate that how much change has occurred in the flu virus this year, so that they make vaccines. So likewise, this happens that every time something happens, so this is because of the changes or mutation in the virus. And during that time, how bad, what did it do? It involves, usually the respiratory system, usually we divide two, upper respiratory, like cold-like symptoms, not a big deal, not too bad, manageable. But when it goes into the lower respiratory, that involves your bronchitis, sometimes bronchitis, and it involves your lungs, which may cause lung infection, which becomes serious. So most of the people even in flu, they died because of the complications. They get into the lungs, they get pneumonia, and they die. So likewise, this is what happened in case of SARS. How much effective, how much dangerous, how many people it can kill? See, when the infection is going on, we don't know exact picture that how many people are dying, how many people got infected, and how many people died. So that's called mortality rate. you divide a total number of tests, confirmed tests, divided by how many people died. That's called mortality rate. So when the epidemic got over, and then people start counting how many people died here, here, here. So they found out that how many cases were diagnosed, and out of those, how many people got killed. So then they see that how bad was it that 10% of people got killed because of that virus. If 100 people were infected, 10 people were killed because of that. And it involved almost like 8,000 people, and 770, this is the kind of typo, 770 people were killed by it, and I'm sorry, 9.6 to 10% was the mortality rate. Then we also heard about MERS. This happened in 2012, and that was more localized, that was more like epidemic, you can say. That was in the Saudi Arabia, Kingdom of Saudi Arabia. That 858 people, they got infected, they got killed out of 2,400 people who were infected. So then again, when this all infection finished, so when they start counting how many people got infected and how many people killed, so that was, they found that the severity of killing people were more stronger than the previous SARS one, and that was 35%. And it was spread by camel, you can expect. Okay, now this virus is called COVID-19. Co is corona virus, virus, disease. COVID-19 is started in 2019. How many countries are involved so far? 116 countries, it's already in. Then total 140,000 people are infected so far. 5,000 people have killed so far. How many in America? 2,445, almost 2,500 people until Saturday. They were involved, they got, infected. 50 of them, they got, killed because of that. And if you see that these statistics comes with those people who are getting sick, and to a level that most likely they are going to be tested. Maybe these are the people who visited ER, because the stress tests are not common. I work in urgent care. Friday, 2 people showed up with corona testing, and we know how nervous we were. So if we have coronavirus test available, like we have strep test and the flu test, believe me, multiply this number by at least 10 times. This is what it is. The problem is that because we are not start seeing it in our community, oh, my friend is sick. We are not taking it seriously. But I'm telling you that we start hearing in our community that people are having symptoms. So Allah keep everybody safe from that. So this is what is suspected that, okay, so how it spread. So it says that we all know Wuhan, a city in China, and they are thinking that bats are the carrier. So when the bats, they bite these animals, so it is transferred into them, or through their excreta, urine, or their the excreta, it passes on to the other animal. And this is commonly happening all the time. But this time, it is mutated after somehow, and then okay, so from bat it will going to other reptiles, snakes, cobras, and this another one, this pangolin. I was also not very familiar of this thing, but this is pangolin, which is now considered the main vector, middleman, through which it is spreading into human beings after getting mutated. What is infectivity? So first thing we see, incubation period. Incubation period, now we all know that this is the time period when you catch infection, and when after catching, like I mentioned, virus goes into your body, it starts multiplying, makes good enough number, then it starts coming out through your from your breathing, from your droplets, and different means. So the time of getting infection to start spreading it to other people is for 14 days, 2 weeks. But median is, so you can get spreading it from day 1, day 2, up till 14 days or when you are going to show the symptoms. So until you don't start showing the symptoms, you don't know if you are sick, although you are cooking. And during that cooking time, during that multiplication of virus time, you can still spread it out. So that's the dangerous thing about this infection. That period is so long that for 2 weeks probably you are not going to show that you are infected, and you will be isolated and you will start taking all those measures. So because of that, it is becoming a problem that nobody knows for 2 weeks that how many people you are going to infect during these two weeks. So that's the main thing. We all know that average, one person before he is diagnosed or he looks for a treatment, he is going to spread it to 4 people, average. It can be 8, it can be 10, it can be 1 or 2, but average. The average incubation period, or when we say that when you are going to be spreading to others, 5 days. Before you can do it, after you can do it, but average time when you are going to spread it, it's around 5 days. So remember one thing, incubation period, average is 5 days. People you are going to infect, out of those 20% of people are needed hospitalization. So if 100 people are getting infection, how many people are going to be hospitalized? 20 people. All right? We'll go further from here. So this is the scary part. So far, almost like I mentioned, 2,400 some numbers. We take the round number. This is 2,500 people are already infected in America. So if 20% are going to be hospitalized or needing hospitalization, so already 500 people are in the hospital. And what does hospital mean? It's not the regular bed. When they get sick, they are usually put into ICU. So how many ICU beds are there in one hospital as compared to regular? Okay. What happened after 5 days? This 2,500 number will become 10,000. And you need 2,000 bed in ICU. After 5 days, 40,000. After 5 days, 160,000. After 5 days, 640,000. And after 5 days, 2.560. And then, is it my maths? That's why I become doctor. My maths is not good. So what is the final number? 1,240,000. In 1 month. So see how much it is important that we should ask Allah Ta'ala to send mercy upon us. Very important. Coronavirus is a means through which Allah Ta'ala is showing us what is the might of Allah Ta'ala. Right? That one virus can make everybody rattle throughout the world. So we have to be, like all our shuyukh and scholars are saying, that take it serious. It's a bala, it's a wrath of Allah Ta'ala. It's not only that we should just spend hours and hours of what's new, what's the video saying, what is the interesting thing came up, and it is that we have to ruju to Allah Ta'ala to ask Allah Ta'ala send mercy. This is going to be 1 month expected until Allah Ta'ala change the situation. Allah Ta'ala. Don't think that viruses, they come, they are more prevalent in the winter time, and the summer time everything will be fine. Viruses, this is what happens to certain viruses, flu virus and the other cold viruses. That's why we don't say. But who knows that what kind of mutation is this? What kind of changes? Is it heat resistant? Is it going to be heat resistant? Then it will be doing the same thing in the winter. So that's why we never think, we kind of escaping from the reality that's coming from Allah Ta'ala. If it goes like how much we know about this virus, this is what it's going to do. So what will happen? That how many ICU bed you needed? It's 2,048,000. All right. Let me give you the idea that we are in America. I have a good insurance. What will happen? In America, we have 5,000 hospitals. We have regular beds 550,000. And we have 95,000 only beds. How many we need? 2 million around in 1 month. When you get infected, how much time that you are going to stay in the hospital if you go to the hospital? 8 to 12 weeks. 2 months to 3 months, I have to stay in ICU or hospital to recover from this virus. So people are getting sick, beds are not available, people keep getting sick, they need hospital ICU beds, they are not available. So what will happen? You will be overwhelmed. Nobody can do anything. So that's why this is so serious. This is so serious that we understand what happened in China. Usually it stays 2 to 3 years. One of the alim was saying that it is tracked from 1300 that every 100 years Allah Ta'ala sent these kind of threats. And it says that it is documented that every previous years, 100 years, it happened like this. Usually stay 2 to 3 months. This is what we see in China. That peak was that, and then it starts getting better now. All right. So if it happens, if we are looking 3 months only, who knows more or less? Allah make it easier. Then how bad it could be. This is why it is very important that we should pay attention. We should bring changes. And it's not me. If I am careful, what will happen? It will go to my family. And it will go to community, my resources. I mean, so many brothers are so much useful brothers. They're helping themselves, they're helping their families, they're helping their relatives back home, here and there. So each one of us very valuable. How this thing spreads? Droplets, When we cough, so we have this sputum thing, spit thing come out. These are the droplets. It depends on different distance, how far it may go. Maximum it would go to 6. Depends on how small are the particles. If smaller microns they will go farther. How heavier they are, bigger they will fall down closer. So this is important. That's why we say that we have to use those prevention things, how we can prevent. Aerosol is the same thing. Once you pass it on, it goes into the air, it may stay there for some time. And again, this is also suspected maybe fecal oral, by your excreta, it can also pass. Okay, how it works? It involves also, beside the upper respiratory, like cough, congestion, runny nose, you will feel, it may also go into the lungs. The regular virus doesn't do that. It stays in the upper respiratory, cough, congestion, runny nose, little bit, fine, khalas, goes away. Here it goes into the lungs. Lungs has some receptors called ACE2 receptors. It goes, binds with them. And what happens that this change, it has transformed themselves, and it develops these spikes things. So this is the virus, the corona, crown-like, and then it has spikes. So the ACE viruses in the lungs, they also have like these kind of receptors for something else, but because of their formation, they go and then attaches with those receptors, and then they attached in the lungs tissues, and they make changes, and what that's called different conditions. Commonly you say pneumonia with ARDS and other stuffs. It may causes a problem. So that's what we are talking. The symptoms will start usually from day 5, where you have upper respiratory. You may have cough, you may have congestion, runny nose, and mild fever, maybe not, but not usually fever within 5 to 7 days. After 7 days, you may start having fever. So that's why how we are checking people on the airports, how we are doing it. We have this thermometer. We don't go close. We do like this, close by. We are not touching. All right, and we are checking fever. If you don't have fever, you're lucky, you go away. If you have fever, you are isolated and you will be tested. So if somebody is having the infections and he is coming and he is before 7 days, so he will not be having fever. So you will be missing those patients, and they are coming into our communities, and they are spreading and they are infecting other people. No, I'm telling you that cough, congestion, runny nose, cold-like symptoms plus fever, and then later it may also give you some pneumonia-like symptoms. That is, beside cough, you may have some chest pain. We usually see you may have some sputum, maybe not. So those are symptoms categorically according to the involvement of our systems. So it says that in 14 days, shortness of breath start coming. It means your lungs are getting started. So either if you are younger people, most of the time, not necessarily, you may recover, fight with the infection, and you will be fine. But for some reason, if your body don't have good enough immunity to fight against it, you can get pneumonia, and then you need to be admitted. So yeah, and how many times, like I mentioned, 8 to 12 weeks it takes you if you get sick to recover from there. Disease start, okay. The second thing is that we have to understand that disease usually starts at one point and then it starts going to the peak. Until it gets to the peak, it is the what we call it, acceleration phase. So starting phase, which was February 20th, the first case which was diagnosed in 20th, and since then it started multiplying, spreading. So it will go to the peak. When will it the peak? We don't know. But when we will start seeing that now the cases are no more new infections, that will be the peak, which can be 1 month, 2 months, 1 week, 2 weeks, whatever it is. So we are still at this time in the acceleration where we are finding more and more of positive. And we will start seeing it more and more because now tests are available. And what we are doing in our hospital, in our urgent care, that anybody comes, the protocol is that we come, doctors goes and do the testing, and then take those specimens, send it to our lab sends it to Quest, and then Quest do it, and it takes 3 to 4 days to report the test. So now you think, for any reason we were not having testing, now we have test, and now the finding of these new cases will be like this. God save all of us, inshallah. Okay, so we are in the acceleration phase, and then when it gets to the peak, and after that will be deceleration, that less and less people will be coming. Okay, how do we diagnose? Usually if you are suspected to be having that, you go to a doctor and then they take viral swabs. It's like taking a swab for flu. You know, we have this thing, it goes into the nose and we take the swab and put it back and send it to the lab, and that's. You can also have oral, so now we are suggested to do both, through the nose, like we check a strap test, through the oral or the pharyngeal. That's what we are going to do. Another thing what you can do is called bronchoalveolar lavage, that when you are coughing, so you're bringing more stuff from inner side as compared to just sitting in here. So that is called a lavage, and you can collect that lavage and send it to the lab. And they're also saying that you can do blood test, and through blood test you can also be find out. The technique we use called PCR, through which we diagnose. Now it comes that who is going to be affected, or what it is seen so far, China and others, that how much is going to be, what age in fact affected. 50 to 59 years, okay, it says that for some reason 15 years and below, they are more favored from Allah Ta'ala, that they are not getting as sick as the older people. And usually 50 before, you are more younger, but not immune, that chances are you will be having less amount of diseases affecting you. And so it says 50 to 59, 1.5%, 60 to 69, 6%, and 70 to 79, almost 8%. 80 plus is going to be double to 15 to 16% of those will be affected. So it is not that they are catching it. Maybe if one of us not careful and having infection and passing it on to others, so then they will be in more trouble if they contract it. And likewise, there are people who have certain disease, they need to be careful. People who have heart disease, they have 10% mortality rate, and then diabetes 7%. High blood pressure and COPD means lung disease like chronic bronchitis, emphysema, and like people who have cancer, they have 6%. So now, kids are seen for some reason. I mean, it's a little, not is it away from the normal observation which we see in flu and cold, that extreme ages are affected most. Most little have less immunity and they can get, and most elderly seniors, they get most affected most of the time. But this time it is seen that this infection, especially in China, it did not affect much in the kids. But again, there are some, we are seeing some deaths in the younger population too. So again, like I mentioned, that we don't know, we are not at the peak. So maybe it's something different according to the geographic location. We see something different, so we don't know. So don't take anything just for granted. No, it will not happen, or we don't have to be careful. We surely have to. Okay, what we can do? New term we are now acquainting ourselves, social distancing. Like I mentioned that when we are talking, or when we are coughing and sneezing and those kind of things, most of the time. Even if we are not coughing, we are just talking, we may produce these droplets which can go as far as 6 feet. So that's why they are suggesting that keep the distance like 6 feet. Second is okay, and this is we are talking about the prevention in healthy people. When you are healthy, it's like alhamdulillah, inshallah, you will not be affected so far. We need to be careful. So this is what we are doing when we are not sick. So keeping away from sick people. If we know somebody is sick, then we need to keep ourselves away. We don't have to go and visit them, that mashallah. So but because of the nature, we should avoid it. Second thing is at our work, at our social, like usually at work, which is we have to go. I mean, we are in a situation, so we should avoid talking directly, face to face. Try to, be away. Don't have to be all the time the face. Make sure that you are not passing your droplets to the other person, and likewise the other person you are trying to avoid yourself. Likewise, all the weddings and all the gatherings, unnecessary gathering for this time maybe. I heard in Pakistan they get all the halls where these marriages takes place, they closed down by government. No more shadi in the halls and all those kind of things. So those kind of things. Then subway, theaters, cruises, we all know that these are the places. Any place where we have more people, they can be affected because of that. Then quarantine for 2 weeks if travel to high-risk countries. Like those 4 or 5 countries, they are suggesting those are the high-risk countries, like China and like Italy, like Iran, like South Korea, and one more I think. So those are the countries which are like Italy. So these are the high-risk. Anybody coming from there, he should be quarantined for 14 days. Why 14 days? Because that's the incubation period. Person should start showing symptoms. If he is having symptoms, then he needs to be admitted. And then others, the common stuff, avoid shaking hands and hugging. Wash hands for 20 seconds. And I think everybody know about it, right? And somebody know how to wash your hands? So what they say, if you are using sanitizer, like in masjid and other places, we have sanitizer. So take enough, and then we go like this. Webs are very important, these things. So we are doing it like this, and then we are going in the back and doing the same thing, one side, and we are doing the same side. And then with the thumb, we are both sides, we are doing this, and then we are doing this. So we are, cleaning our fingers. And then if we can also do this thing, making sure that we are cleaning our finger. So by the time you will do it, inshallah, say subhanallah, 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 20 times, you are getting reward. And inshallah, the more barakah will come, and you will be more cleaner. Second thing is that try not to cover your face. Touch your face. That, we have habits, sometimes we don't know that how many times. Somebody else, your wife probably will tell you that how many times, even unnoticedly, we touch our nose and our, all this thing. Try to avoid that. And these are the things which you have to learn. Believe me, even I have a problem doing it at home. Work, everybody's doing it, sanitize, you go there, you start doing this by the time you go there. You go inside, you wash your hands and all this. 2 days ago, we are doing so much that we feel that our skin is getting irritated. Because these are all chemicals too. So what we do, go inside, we wash our hands before we check patients. And this patient was a teacher. She's 75 years old. So she washed me up. We don't do every time 20 because we also have no excuse. But you go wash and this and the, after that you dry it, and there's a way. There's a way that how you do it, that if this is the faucet, you start running the faucet, you take water, and then you take soap and you clean it. After that, the same, you wash your hand, then you take your napkins and you dry it, and with this napkin you turn the knob off, and then we even use the same napkin to open the drawer to get our gloves, and then we wear the gloves. So I did not wash for 10 seconds. So the lady told me, this lady, she said, you didn't wash your hands for 20 seconds. So it is there. It's not easy. But if we have at least be thinking of our patient, being a medical provider, if we are thinking of our family at home, so inshallah that will make it happen. inshallah. And like touching, and then okay, the other thing is that the surfaces we touch we don't realize. So like we all have computers, so we should make sure that we are cleaning our keyboards and our mouse, these mics things and knobs, doors when we're opening. So all those things need to be, make sure they are cleaning. Like I mentioned, elevator knobs, So what people are doing now, it's not available, that people are keeping a small bottle of sanitizer. So frequently, they take it out, take a little bit, put it down into this thing, and they try to do it, try to clean it. So again, is it easy? No, it's not easy. Is it forgetful? Yeah, you can forget about it, but try to do it so that it will become our habit, then it will become easier. So, okay, and then if somebody is sick at home or suspected sick, again, everybody don't have to go and get tested right away, all right? If you can do it, that's fine, but you don't know if it's a cold, you take a chance, but suspect anybody who's having these symptoms that he may have coronavirus. So because of that, what you are going to do, try to isolate, like quarantine we talk about, do home quarantine, then make sure he's separate, he's in his room, keeping in his room, try not to use the same bathroom he's using, because we know the excreta can spread it too. And then again, no visitors, that try not have anybody coming in. Even the family members try to cut it down, unless it is necessary. And then again, same thing, hand wash, hand sanitizer. Make sure if you are dealing with that person, if your husband, if your wife, if your kids, get your gloves on. Wear your gloves when you are dealing with them. And try to keep their glass and dishes, anything they use, try not to use it for a few days. And likewise, make sure that if they are doing their laundry, the laundry should be separate from others. And any surfaces which are there in the room or that person is in contact with, try to spray it or bleach, like clean it, because you can pass it on. So because what happens that if somebody has infection and if it's touching the surface, the virus can stay there for 3 hours. So that's why 2 to 3 hours, that's why we have protocol that if we see somebody in an office and so we don't see anybody at least for 2 hours after cleaning and doing everything, because that's expected that virus can still be live there. So it's always nice to clean those surfaces. And if that person is, this is dryness, this is not cold. If a person is developing clean-cut symptoms, then you have to take him to the hospital. All right. My understanding that now these tests are available in ER. You go there, but do one favor: call your doctor. But when you go anywhere, give them a call that I'm coming, so that they prepare for you. They don't let you sit in the common waiting area. They don't let you sit in the ER area. Because what will happen? You are sitting there, you're passing it on to somebody who came for heart disease, somebody who came for his other conditions, and now they're all infected. And now when they will go into community, so they are going to. And don't go to these places unnecessary. Also, don't go to your doctor. These are the most infective places. All the sick people come there. They spread these droplets, aerosol. So don't go there unnecessary, but if you have to go in this situation, call, just tell him so that they are prepared. Like it commonly happens, somebody comes with bad rash, we don't let them sitting in the waiting area. We bring them into the room, assigned room, and we check them. After that, done. So that's what says that, even if you have to seen earlier, just tell the doctor, I'm coming, I probably have coronavirus. Even if you are going for, I'm not suggesting anything. So it is important. It's a responsible act of, letting them know that you are coming. And if somebody is sick, what he should do? Isolate from others and animals. Sometimes we have these cats and other stuff, those other animals. So complete isolation. You should use mask. The sick person should use mask. He should make sure the surfaces are all clean, no shake hands, and cover cough. This is for everybody. Cover cough. How would you cover your cough? No. You are making a barrier, and you are then shaking hand. No. So what we do, we see common thing here. We see that we cover by this, so that we are not spreading it to the other person who is in our area. Second thing is that best thing is if we carry kind of a napkin or something. So whatever you are not using your head, you are using a napkin, so that you can throw it off. And so those are the things. And but again, remember one thing: if you are doing like this, so you are not passing it on to other, but this area is contaminated. So if you know that you have suspicious symptoms, so make sure when you go home. I mean, it's not easy to wash, but if you have one or two jackets, then try to wash it then. Otherwise, the napkin is the best thing. You can throw it off. And surely you will not be going to, because you start symptoms. We still see in the masjid somebody is coughing, somebody is sneezing. So we should be responsible. I mean, we should not come. I mean, it's very difficult for me not to come to the masjid for salah. Mashallah, everybody sitting here, we are, alhamdulillah, with Allah fazal, we love to come to the masjid. I mean, it's hard. Inshallah, Allah Tabarak Ta'ala know that I'm doing with a good intention, to make other people sick. So I should stay home and I should do my prayers at home. And social gathering awareness and wash hands and nail cuts. Again, sunnah come. We are suggested every week on Jummah, preparation that we should be cutting. So, but again, here we are forced to do that. So we should make it habit so that when time comes for the prevention, it helps us. And then again, you have to see a doctor, call your doctor before you go there, because most likely we will be having these tests available, so that you can go to your doctors, and so you will be going to the doctor, call them and then go there. What are the treatment? Frankly speaking, so far we don't have any treatment unless if somebody is really sick and we have to use, and this is we are talking about the hospital. There's some of the antiviral medicine. There are antiviral medicine, like people get hepatitis, we treat them with interferon. So there are some antiviral medicine which were used in people who were SARS positive. So it says that this coronavirus is like 80% is like the same virus which caused the SARS epidemic. So they say that medicine can be effective. Likewise, they were working at that time even for developing a vaccine. So they say that probably we can make some changes and try to develop new vaccines. They are working on them, but it takes months before vaccine comes out. People say 1.5 years or at least 6 months for the test to develop for what we call the rapid test, which you can have results right away. But again, this is only for people who are hospitalized, and so these HIV medicine or MERS and the SARS, they are there, which otherwise there is no specific medicine which can be used. One thing which I found very useful, that now mashallah a lot of people are doing, that see, most of the infections, they go through nose, because we are breathing through nose. So this is the first entrance area. So if we can take some Vaseline, or we can take like olive oil. We already have mashallah olive oil, any kind of oil, and just put on your pinky or with a Q-tip and dip it, and then do it coating inside. Right. So what happened that these viruses, they have an easy way to go through water, because water is not a thick barrier. It is easy to pass through the. Let's say, like if you are in competition and if you have to swim in water, it's easier than swimming in oil. So oil provides a thick layer. So viruses to pierce through and getting into your mucosa and to the blood will be much difficult. So this is every time you are coming out for the masjid, you are going to work. I would suggest just keep a small bottle at work too. Every few hours, 3 times a day. Like we go to the doctor and take medicine 2 times, 3 times a day. Just take.
Basically, water is low viscosity.
Right. Oil is more. So it will become kind of a barrier, and it will protecting you to have those infections go through. And again, like I mentioned, this is coming from Allah Tabarak Ta'ala. Allah Tabarak Ta'ala is sending this thing. We have to rely on Allah Tabarak Ta'ala, but one person gets it, other person doesn't get it. Why? We are in the same community, We should all get infected, God save all of us. But this is the rahmah of Allah Tabarak wa Ta'ala, that one person develops high blood pressure, other person doesn't, whatever theories are, whatever it is, but infection diseases, it is, so this is all from Allah Tabarak wa Ta'ala, that it will be mercy of Allah Tabarak wa Ta'ala. So we have to get ourselves connected, and we should have realization all the time, and we should be asking Allah Tabarak wa Ta'ala to save us. Otherwise, this is all the information available that what we can do and may be helpful or maybe not helpful. So that's why. So this is the information. And again, like I mentioned, if we are making our time, we are sitting here almost like for 45 minutes, and 45 multiplied by this maybe 30 people. We see how much time we spent in this, and beside preparing this. But if you are not making changes, bringing changes, it's not easy, it's very difficult, inshallah. But if we start making efforts, it will be benefit for a long chain of people who are associated with us, inshallah. So, and it's also sunnah for us that we are doing it to please Allah Tabarak wa Ta'ala, to ask Allah Tabarak wa Ta'ala keep us away from this problem. But if it comes, or in a preparation, we are doing it, the part of sunnah. So inshallah we are following the deen of Allah Tabarak wa Ta'ala. So Allah Tabarak wa Ta'ala save all of us and keep us away from this problem.
There's a question here. 1 second. So this mobile testing, some state already implemented. Is it same as, like, because he said 3-4 days is too long?
Yeah.
So this mobile testing,
right. Yeah. So see, it's different. What you're talking about Rochelle, New York, that what's happening over there, that they are saving all their staff. Believe me, it's why we get paid that much, because we are the front line, and we are the first people who may get infected. Our nurses, our just registrar, reception, and all those, really you feel it. So to avoid all the situations, surely, if you have this drive-through area where people are fully protected and they are just doing this test, and you're gone, and you are not affecting the other people, yeah, surely if something can happen like this. So number one, don't wait too long, because you don't know how your body is going to react. So if the test available in any situation, and if you think it's needed, go and get it done.
Thank you, Dr. Saab. You have a very detailed orientation of this coronavirus, and we would likely to appreciate your efforts and sensitization of the community. I'm just giving you a background of 1918, when this epidemic happened. Like the people mostly, like at that time of Muslims, they were praying a lot. So first of all, we have to pray to Almighty to forgive our sins and shower His mercy. My question is, like, as we are going inside and we are probing and researching in detail, the biggest question mark is like the cure of this disease. And the vaccine, like being a doctor, you can tell us, like, the researchers are saying it might take a 12-month time frame to create a vaccine for this disease. So can you please explain? Like,
this is what happens, the procedure thing, that you try to find out exact nature of the virus, and then you start making and developing these tests. Even this, it took so long, even in America, even if it was developed in China, and whatever kind of preparedness was going on over here, that we are just able to develop the test. And then again, we don't have any rapid tests that will take further maybe 6 months. And so it is the due, process that this is how much time it takes. And the second thing is, whoever is developing this test, they are making millions of dollars to develop that vaccines and other things. So they also see the business perspective, that how it's going to affect me, and if this is one-time thing, so how much interest they will be having until they stay there, like flu. So there are a lot of decisions they usually make before they develop something.
Brothers, please be seated. There's a CIOGC talk, and we have samosas after that, so another 20 minutes, inshallah.
Thank you very much, Doctor. It was very impressive lecture you are given. A lot of people, they don't know what is a droplet. So most of us are not used to covering our cough with this hand like this. When they cough and cover their hand like that, then they might by mistake, they can shake hand with this. The drop, just like you told us, the covered droplet speed 3 to 6 feet, then they drop. So if somebody touch, then it is infected. So we have to encourage people to cover cough like this, so that instead of hand.
I just before we were leaving, it's a not bad idea to bring your own prayer rugs, because what's happening if you have it, people are coming and they're
I just saw one
doing
person.
it.
That was the question.
Yeah, we should all be doing it, and because it can pass through the rug, and the administration can do more often of these vacuum things.
Yeah, 1 second.
For example, like regular, like if you have a short of breath, or you have a runny nose coming out, or you start coughing, many people I know take like regular medication like Tylenol or Claritin. Are these for the cure for this disease? Can we take those medications at the same time, or do you go directly to the hospital?
Yeah. See, number one, you should know if you have a medical problem. For example, if somebody have asthma, so they can have this shortness of breath, but they should not be having runny nose, congestion, and those kind of things. So if these are the new onset of symptoms, where you are having these in any sequence, cough, congestion, runny nose, shortness of breath, this is unusual. At this time, you will suspect many things. Out of those things, one thing will be this viral infection. So you should go and get tested. Hopefully you don't have it, and you may have maybe a flu. A flu may can give you the same things, and or you can have some other symptoms which are causing it, so that you get the treatment, because this is not normal. Okay, inshallah. So, sorry.
Then you are okay. If not, then you got this sign of corona.
No, I think it will become easier if you hold your breath for 2 minutes. Then there will be no problem. No, you cannot do that. No, I don't know. No, I don't think so. Because a lot of viral infection, they act, look like the same.
One question.
Jazakallah khair. We have heard in some of the masajid, I'm not sure about Illinois, but in California they're doing this social distancing. Like they're, even in Jamaat, they're keeping 6 feet distance. Is that something you think would avoid? I mean, I know Islamically it's not recommended, but in, a lot of masajid in California are doing it now.
So in between person to person.
Even in Jamaat, I have a lot of pictures I can show you.
Yeah.
I think we have to ask that to a scholar,
Yeah,
right?
the scholars.
It's better to ask a scholar.
Is that something?
I mean, distance is good, but we, will be able to take it. I've also seen some massages in the local massages too. They are doing this thing too.
Okay. Any other question? So before we invite
Sheikh
Brother Abdullah, Michelle.
No, give me that. Also the handle. The handle. And this will be confirmed by the doctor. Was that a good practice?
A very good practice.
Alhamdulillah. No, first, as a representative of CIOGC, I commend this as an excellent presentation. It's one of the best I've seen thus far. And I'd humbly request if you could share that with us so we can broadcast this out, because you gave some real good practical advice for all of us to follow to ensure that this disease does not spread more than it has to be. Because oftentimes people come in, like we at Downtown Islamic Center, we were not supposed to have a Juma. Well, what happened? Enough people showed up for Dhuhr, and they said, oh, well, we got enough here. Why don't somebody give a khutbah right quick, and then we can say we've had Juma. Well, that happened, then all of a sudden you have people in the lines, once again, close to close, and someone starts sneezing, coughing out loud, not covering their mouths. And it's, once again, we have to be sensitive whether or not that person has the germ or not. You're spreading germs, and in this particular time, we have to be sensitive and exercise reason when we're dealing with things.
Michelle, you want to come? Okay.
Jazakallah khair.
Yeah. Jazakallah khairan. So, Just to give an introduction, Brother Abdullah Michel is from CIOGC, and they have done webinars related to coronavirus to educate the people of Chicago area and the suburbs. And he is also running the Census 2020, how we can register online, because most of you people would have got a pin in the mail in the last few days. So how we go about registering on the census website. So he's going to talk to you about that.
Assalamu alaikum.
Do you have that first photo? Thank you. Thank you. So you press on that. Oh, okay. Thank you. Okay. You can go to the website. Okay. Okay. Oh, thank you.
Assalamu alaikum. Well, I guess I don't need this one then. You've patiently heard that first presentation. Was a good presentation. I don't think mine will be as good as that, and I don't want to keep you a real long time. But notwithstanding the health crisis we're facing, another very important event is happening in our civic lives, and that is the completion of the 2020 census. And just a quick few brief remarks why the census is important. When you pay your taxes, your federal taxes, they go to the federal government, and that money, a good chunk of that money comes back to the various states in the form of various types of programs. Medicare, Medicaid, education funding, housing funding, and even infrastructure funding, building new bridges and maintaining the roads. Well, when you get a big pot of money, you want to say, how is it divided? Well, it's divided up fairly. Let's say if there's $100 and if there's 50 people in this, well, they get 50. There's 25 people, they get 25, and so on and so on. But if you have a situation where there's $100 and there's 50 people here at MSI, but only 25 registered, then you're getting half of the money in your area that you should get. So, and what is that money used for? Well, recognize that for many people, once they reach age 65, their only form of insurance is Medicare and Medicaid. If that money is not there, they're going to be denied needed assistance. Right now in this country, because of inflation, notwithstanding they talk about it so low, but the cost of living continues to increase. The cost of affordable housing is increased. Here in the state of Illinois, in some of the city areas, let me backtrack one step. In terms of what is reasonable housing, it's estimated should be no more than 30% of your monthly income. To the extent that they call your burden. To the extent that you're paying half of your wages, you're deemed to be severely burdened. And there's areas in city Chicago where the households are paying up to 50% of their monthly income on just housing. As a result, other services get denied. Well, maybe I won't go to the dentist, I won't go to the doctor, I won't get this medication, I won't get this things for my children. That money that's used to support like daycare programs or housing developments, not only for, let's say, needy families, but also for the elderly. That's another question that's becoming big in our community. There's a lot of us are getting beyond 60, where we're at Medicaid or Medicare age, and they'll no longer have the ability to maintain a household, or never really got to the point, have always been renting, and they need affordable housing. So I can continue to give you a litany of reasons why it is important. Accepting that for a moment, the question is, well, I don't want to do it because it's troublesome, it's too long, they want to ask me my social security number, my banking information, and no, that's a misconception. There's only 9 questions on the census, and they ask basic questions: your name, your address, your age, date of birth, and they ask that, what is your race and what is your ethnicity? And then they ask that same question for everybody living in the household, and that includes even a newborn child. All of them are to be counted because this is the basis for how the pot in DC is going to be divided when it comes back to the various states. The other aspect of it is well, who's going to find out about this information? Now, to me, there's a term by profession, I'm an attorney. There's a term called red herring. And what that really means is this is something that really sounds scary or spooky, but it really has no mere essence. And that's when people talk about, oh, I'm going to be giving up some information that I don't. I don't know how many of you sitting right now in the Missoula area have your real ID. If you have the real ID, you've already given more information than the census has. When you file your income taxes, you're giving more information that's required than on the census. The only thing that's not is your date of birth, but that's on your driver's ID. Okay, so you're not asked your social security number. They're not asked if you're a citizen. They don't ask your immigration, your status here in the United States. It is those 9 questions. So it should not be something feared. In addition, under law, and I'm without dealing with those who may have a degree of paranoia to say, oh, I don't trust the government. Nonetheless, there are laws in place that bars the Census Bureau from sharing that data with anybody, even President Trump. Now, whether you want to believe that or not, I can't. That's on to you. But I'm just telling you how it is structured. But even with that, even if you think it's shared, the point I'm making to you, you've already given up that information anyway. So let's not make that an issue. The other thing is, a big challenge now for this census is, unlike before, some people still thinking in the mail is going to come this big envelope with this big questionnaire. No. Everything now, they want to do it online. Now, online is a good thing and it's a bad thing. It's a good thing because right now we'll kind of show you in a moment how that's done. It's very easy. It's only, like I said, 19 questions and you're done. And you can be done quite quickly. The challenge is that not everybody is computer savvy, particularly as we go up in terms of age. I recently visited a senior citizen home in terms of encouraging them to participate, and I told the manager of the home that, this is online, because she wasn't aware. What? You're not going to get any of the people in here to do it. They have a deathly fear of the computer. So we got to recognize not everybody in our community is going to be receptive to doing this. And this is how, inshallah, we need everyone's help to make sure this happens. With all that said, you will receive in the mail, if you haven't already, they started mailing the March 12th. You're going to get an envelope just like that. Now, we X'd out the address because this is someone's actual letter. It has census, but what it says on the top is residence. Well, we're being inundated with political mail right now. If you saw this, you probably say, oh, this looks like junk mail. If it's just residence, they're not talking about me. Yes, they are. Inside that, inside that envelope is this letter. It once again doesn't identify, because what they're saying is, what you're unaware of is that prior to this, in 2018 and 2019, the United States Census Bureau counted and determined every household and gave it with their address. So they're just mailing it to the house. They're not assuming because someone's name is addressed that is. They're saying whoever lives in this household, this is to be completed for any and everybody. So even if you had a relative that's visiting from overseas, they're going to stay here for, let's say, 3 months. They should be listed as a member of the household. If it's a child, newborn child, they should be listed on in responding to the census. But the point is, so don't throw it away because it has residence. This is a very important piece of mail. And why it's important is because right there in the middle, once again, we blocked out that it's called a PIN code. When you go online to the census, they're going to ask you for the PIN number for that household. So let's just say you're at 1875 Bloomingdale. That's your house. All right. In there's going to be a 12-digit code. When you go online, it's going to ask you to enter that digit code. You enter that, and then you're going to be presented the census questionnaire. And then you're going to fill it about everybody in your household. So what we're trying to remind people is don't throw this letter away. It's not junk mail. It's not another form of political advertising, seeing that's where we've been inundated. This is your link, because that's how they're going to identify you. Now, some people, even for those that still don't want to go online, there is going to be a 800 number that's listed in the letter where you can call. They will have people that speak English, Spanish, I know Arabic, I'm not Urdu, but they will have someone that can help you in Urdu. But it is designed to help people navigate these questions and get the census complete. Now, before where the particular website is called thank you.
Yeah, while you were talking, I was just checking my2020census.gov.
Yeah.
So it's very simple. Even if you forgot you have lost your letter, you can get it from there. I just got it.
Oh, this is not it. Well, here, let me, no, yeah, I did.
It's mycensus2020.org, gov, G-O-V. My 2020
Whoops.
census. No, one word. No. mycensus2020.gov. Yeah, this is correct. G-O-V.
Oh, here, I think this is it right here.
Census.gov. Yeah.
All right, so you would go to this particular place here, and it says start your questionnaire, and now here's where they're asking for that PIN number. And I don't have a PIN number to enter right now, but
If you don't have a PIN number, if you just click your address. If you don't have, it's written next. Yeah. Click here. So there are options. And there are options. So a U.S. citizen on the top one. Check this one. Yep. Go next. And now it'll ask you for the address. That's it. As soon as you give your address, you will get it.
yeah. So that is how simple the process can be for you. Now, the last thing I would say to you this afternoon is this: we know not everybody is going to do what we've done, and it's important if you will have events here at the masjid. The masjid has gotten a couple computers. They're going to have them programmed so to invite people within reason. Not more than 250, but nonetheless to invite numbers to come in to fill this questionnaire out, because like I said, it is very important, crucial to our community, and whether you look at it as being the Muslim community or you look at it being a resident of Glendale Heights, because they're going to get their money based on people, or the state of Illinois. All of this is important, so we encourage you to have regular events where you're inviting your membership to come in and complete it. To that extent, my last couple of remarks are these. Once you do this, and I speak with Imam Rashid about this, is the Census Bureau will bring in somebody at least once to help navigate this process, to make sure it goes all smooth in terms of getting through these questions. And they will come out any day of the week, including Sunday. The other thing is what we're asking each member organization in CIOGC, if you will make a pledge. What's that pledge? That pledge is we commit to have 100% of our membership complete this questionnaire, and we pledge to reach out to 100 of our neighbors. Because once again, the thing about this is the census is a kind of a unique opportunity for us as a Muslim community to reach beyond the four walls of our masjid, to interact directly with our neighbors. to let them know we are just as concerned about the welfare of Glendale Heights, DuPage County, Illinois as anyone else, and to encourage others to participate. This starts to build relationships and understanding between yourselves and everyone and your neighbors. So inshallah, one of those things would be an opportunity to invite others to come in and complete their census and share this information with the general community. Assalamu alaikum.
We have a question.
Yes.
1 second.
Thank you, respected speaker. I'm basically a part-time realtor, and I have data and statistics of the population of Illinois. For the last 10 years, or you can say a decade, we are the second state in the United States who lost almost 6% of their population. And according to the statistics and the Census Bureau, we are just increased by 1%. So when you are saying they will distribute all those funds and all those stuff to the states according to their population, what's your recommendations and suggestions, like other than the Muslim community I'm putting aside, like we are not getting that chunk of money, honestly. So there is a loss of population in the last 10 years. So Illinois is not in a position, we might lose one senator, not senator, like House
Representative.
of, yes. So situation regarding the population of Illinois is the worst. And we are not anticipating. We had an NAR in Tennessee recently where this issue was very much highlighted. The brokers from the Illinois, they highlighted this issue. And we are behind, very much behind in terms of getting the funds from the federal government.
You know, let me respond to that, because in essence, what you've done is underscored even more the importance of getting people counted. The statistics do bear the fact, what you're saying, that Illinois is losing population, and
is
and
that
it is
because of the high
significant.
taxes?
Pardon me?
Is that because of the high taxes in Illinois?
Well, I mean, once again, if you want to talk about that, Illinois had, in terms of taxes, we have the second highest real estate taxes in the nation, only second to New Jersey. But the point about it is once again, the fact that we're losing population doesn't take away from the fact there's certain basic expenses have to be met. You've got to build, if a bridge is falling down, it's got to be repaired. If there's need for housing, I mean, just from a moral obligation, we want to make sure that though the elderly and those that can't afford have a decent, affordable housing, have access to decent, affordable education. So that makes it even more important that if we know we don't have, our numbers are increasing, we want to make sure that everybody who is here is at least counted, if nothing else, to maintain what we have, or maybe realize some growth, but not to continue to lose, because that doesn't benefit us to the extent that we are invested in this state as homeowners, and this is where we have our livelihood.
Any other question?
So even without the PIN number, you still can register, right?
Right.
No, so you have to retrieve your PIN number.
You need the PIN number to get into, like we said, but to the extent that you don't have it, as the brother just showed us, you can do it by the address.
That is.
Yeah. All right. Well, yes.
Because sometimes postmaster, just like country lane south,
No.
so he put the country lane north, because that PIN number belonged to my other neighbor, so I just have to exchange. So you have to see your address very correctly.
Yeah.
Okay, if there are no questions, I just wanted to introduce Khalid Bhai. Brother Khalid and Muzaffar, there are two of our Musallis, right? So they are going to be helping or facilitating those elderly people who don't have a computer in the house, or they are not familiar to get onto the website and do the follow the 9 questions and fill it up. So Brother Khalid is available every day after Asr. He has a new laptop where he will work, and Muzaffar Siddiqui, he is also a project manager in IT. So they are both available every day after Asr, and they are available also on weekends at Zohar time, after Zohar, they're available. So anytime you'll have any requirements, if people cannot fill it up, inshallah.
Is there a specific deadline for filling out those census?
Before June 30th, online.
No, yeah,
And it'll be extended for
July
some time.
31st.
Now it's July 31st?
It's July 31st. June. Well, what it is they're MSI and couple are working with SIOGC with with on a census, working with a census grant program, and that so, and most of those grants ended in June, but the census itself extends to July 31st. So it's important to continue to educate. As one person said, we have one good shot to get it right, and that shot ends on July 31st. So whatever you do, encourage those that you know, your family, your friends, and your neighbors to complete the census.
Inshallah. If there's no other questions, please proceed to the meeting room. Where are the samosas kept? Jamil bhai? Outside? Outside, yeah. So outside there's a table near the elevator. Please go ahead and have samosas. Jazakallah khair for coming, inshallah. Yeah, you have to.
Here's mine.
Up to July 31st, if they are going to be in the country. Yes, visitors. Yeah. So the question here is, visitors, if they're staying in their home, for what's the period? Like they should be there till July 31st?
No, whoever lives at that house on April 1st, that's what they say.
Who live on April 1st
Yeah.
in that house. If they have come from Pakistan or India, they have to fill it up, correct?
Correct.
Okay.
Yes.
April 1st. If they are here April 1st, they have to fill it up. Visitors.
Anybody registered, if you could have a signing list, so we know, we can say MSI reported these many people completed this.
Who did it here?
Yeah.
But those who did it in their houses, we wouldn't know that.
Right, well, the other thing is, here's what we can do. If anybody fills it out at home, ask them to say, I filled this out, I can show you here. Someone sent me an email. It said, after we did our presentation, it said, I went home and I filled it out. Thank you. So in other words, communicate with us, and then we'll use that communication to get credit for that. Okay?
Yeah, sure.
So, any question you want to